This is Dr. Corey Maas on Looking Your Best. One of the commonly asked questions that I have, especially in people who have had previous facelift or neck lift surgery coming in for the first time, is about the thick cords or bands that are in the neck. And are they normal and should they be there? And frankly, they are normal structures. The thick cords or bands are called platysmal bands, and what happens with those muscle bands is that there's a very thin sheet of muscle that envelops the entire neck. And in particular, in the midline, the muscle begins to separate and bunch into a cord. They're usually paramedian or on each side. Sometimes you'll even see them on the sides of the neck. And these bands or cords of the platysma are not important. It's the grimace muscle that we're talking about, and it is a very large sheet of muscle. When I do a face and or neck lift, I'm always elevating the skin if we identify any banding, and I'll find and cut the band. Physicians will like to elevate the skin of the entire neck and actually sew the bands or cords together up the midline here. This is called a corset platysmoplasty, and there's some potential advantages to that, but also can create some bunching of the skin. To have the vectors of elevation coming from behind where the skin is just pristine in the neck. There's no bunching, there's no tethering effect there. And so by going underneath the skin, identifying the platysmal bands and cutting them right at the what we call the cervical mental junction, right where the chin meets the neckline, we're erasing the band or eliminating that cord, and at the same time we're preserving a nice smooth skin contour to the neck. Platysmal bands or cords of muscle in the neck are often very disconcerting for people. There are very easy options for managing them, and some of them are surgical, some are non-surgical. Actually, Botox, Dysport, and Xeomin can treat these also. So if you have any questions about platysmal bands or their treatment, or if you have platysmal bands after surgery, you might want to go back to your surgeon and ask if you can get those improved. This is Dr. Corey Maas on Looking Your Best.